Don Berwick, I'd like to start by thanking you on behalf of the Nuffield Trust and the Commonwealth Fund for giving this interview. And I wanted to talk about the Affordable Care Act, which is, of course, of great interest internationally, both from the perspective of increasing coverage for uninsured Americans, but also for all the ideas it contains for keeping costs down and improving quality, which is becoming a bigger and bigger concern for countries across the world as they're faced with economic crises. And of course, you know, you've had an unparalleled role in trying to bring some of these ideas to fruition in your former role as the head of the government agency leading some of these innovations at CMS. And I wanted to ask for your reflections now, almost 2 years after the Act was passed, about what was beginning to sort of excite you, give you hope, that was beginning to work in terms of some of the new ideas that are coming through in organisations, in providers, that contain costs but also improve quality at the same time.
Well, it was a real privilege to get to help implement the Affordable Care Act. I'm, of course, excited by the human rights side of it, the idea that America is going to finally take a big step toward making health care available to everybody. But the quality side was equally exciting to me. And I think what motivated me the most was the response of the healthcare community. Doctors, hospitals, health systems all over the country challenged now to really change their models, the models of care, their business models. They're welcoming it, they're embracing it. When the Innovation Center, which was created by the Affordable Care Act, announced, for example, the bundled payment demonstration for hospitals, I think literally a couple of thousand hospitals expressed interest in it. The Accountable Care Organization idea, which is a fee-for-service based system, but still able to consolidate payments so that care can be continuous, the response has been overwhelmingly positive. I think the American healthcare providers are ready to make changes now, and that's very exciting to me.
There's obviously a lot of interest on our side of the Atlantic in the accountable care organisations, and one of the things that's interesting to us is to what extent these organisations, as they collaborate together, will be able to get the power away from hospitals in a way, that this is only going to work really if we try and keep people well and out of hospitals. How is that dynamic playing out in the examples that you're coming across?
We have to move away from a hospital-centric system. That's not the best way to help people heal. It's not what people want. People don't want to be in hospitals, they want to be home. So the idea that we build healthcare centered in institutions where people stay in beds, that's really got to become history. We need hospital care when we need it, but not when we don't. There are many kinds of encouragement for seamless, integrated care in the Affordable Care Act and in private sector changes. One of them is the Accountable Care Organization. So the challenge here is, can we learn to cooperate? Can hospitals and physicians and home health care and others get together to keep people healthy and at home where they belong? I would say progressive, enlightened hospitals, those who really are reading the future correctly, are changing their models. They're stopping thinking of themselves as kind of the core of the system, more as a supplier, and saying, how can we get people where they want to be, home and healthy? I think for many hospitals it's a frightening prospect because they have to change the way they think. They've been trapped in a revenue-driven, keep the beds full, fee-for-service model, and they have to rethink it. I think they're up to it. I wasn't sure about that until actually the past few months. I've been traveling around the United States, visiting hospitals and hospital systems, and I would say, without exception, they're asking the same question, not whether they need to change, but how, and that's got to be the beginning of something good.
Does success for these hospitals always mean smaller hospitals? Are they being imaginative about the kind of role they might be able to play?
Success for hospitals here will mean different hospitals, a different kind of place, much more orientation toward supporting autonomy and self-efficacy for patients, much more mindful of integration of flows out to the community. I think I have this dream that somehow the word discharge would disappear from a vocabulary. Hospitals need to stop thinking that way, that they're part of a continuous journey for the patient, and I think they'll learn. Will they be smaller? I think in the U.S. we're probably over-vetted. We have too much capital, too many hospitals, too many beds in communities, and we have to unwind that now. We have to move away from that, so those same resources can be reallocated and devoted to community-based, home-based care.
Now, one of the ambitions of the Affordable Care Act was also to try and improve prevention, public health,
yes,
the really upstream stuff. And this has been a challenge everywhere in all developed healthcare systems, is that, you know, the money tends to end up in the more acute side. It's what's pressing. What signs do you see of success and progress on the prevention agenda?
Well, the aims we need socially, I have repeatedly espoused as the triple aim, the three-part aim. Better care when you're sick, so you're getting better well and fast and staying home. Better health for populations, so you don't have to get sick in the first place, don't have to have your heart attack or break your arm or become depressed. And then reducing cost through improvement of processes. Better care, better health, and lower cost through improvement. In some ways, the hardest part of that is the better health piece, because it goes way beyond healthcare. We're embedded in our communities in structures and habits of behavior and, I don't know, legacy beliefs that keep us unhealthy, make us unhealthy. It's reflected in obesity, in the epidemic of diabetes, in asthma care that's growing really still. I mean, asthma as a disease is still increasing. We have to get away from that. That is going to be a matter of both reinvestment, moving resources into public health and the preventive side of care, and breaking the boundaries of healthcare itself so we can work better with communities. I'm seeing a lot of interest in this. I think everybody knows now that obesity alone is a plague we can't afford.
I'd like to ask you about the public response to the Affordable Care Act, because one of the most puzzling things, I think, from an international perspective, was the degree to which so many Americans, and these look like regular, ordinary Americans, you know, with families who were, you know, patients who obviously who are unwell, like the rest of us, who were implacably opposed to reform and afraid of it in a way. What do you think will happen to this opposition? Do you think that over time, as people see that healthcare, if anything, will improve, that they will get coverage, that this will melt away? Or do you see this as being really quite entrenched and problematic for the future?
The great kind of leader in the thinking about improvement of products and processes and services in the world of the last century, W. Edwards Deming, once said that the customer has no expectations that the producer has not created. It's a rather deep idea for me. That's what has happened. The public has a belief system created by those of us who give care. We thought, and therefore they thought, that doing more things was better. We, like they, became enamored of intervention and institutions and the kind of the glory of healthcare that's allowed us to cure diseases that were fatal when I was in training. They are acting on what we taught them. Now we're learning different. We're learning in healthcare, more care is not always better, frequently is not better. That focusing on the needs of the individual patient is better than just some homogenized system. We've learned that patients can do a lot for themselves that we thought we had to do for them. We've learned to mistrust some technologies because they introduce safety issues. Now that we're learning it in healthcare delivery, we really do have to teach that to the public, and they'll come along. Of course they'll come along. They want what we want, which is that they be healthy and thrive. So I think we're in a transitional mode. Around the Affordable Care Act, it arrived at a very tough time in society. Economic recession, fear around us, global conflict, and the public is frightened. They're afraid something will be taken away from them. And we need to coach them through that fear into a much better system. Will they be better off? Absolutely, yes. And the Affordable Care Act, even just that law, as it starts to get into place, is producing already benefits for people. Millions of children now covered under their parents' policies. The drug benefit problem in America, the donut hole closing, much more emphasis on prevention, much more chance for people to meet with their doctors to talk about staying well. I think the public's going to see this. The benefits will start to come in. And if we're disciplined as professionals and talking about the new vision and how good things could be, I think they'll be ready to hear this.
Don Berwick, thank you very much indeed for talking to us.